Good morning, everyone. Thank you all for coming. I'm Dr. Keith Edwards, and I have the distinct pleasure of introducing Dr. Howard Weiner. He's the director and founder of the MS Center at a little hospital in Boston called Brigham and Women's Hospital. And Howard's been a friend and mentor of mine for decades. And there's some people in this room whose life have been saved because of the pioneering thoughtfulness and really ahead of everyone else in the world in terms of therapy. And every time I meet with Dr. Weiner, I learn something new, as I did this morning as we were driving over here. So he's won international awards, and I was happy to be in Madrid when he won the Denzel Award, very prestigious. So anyway, Dr. Weiner.
Keith, thank you very much. It's a pleasure to be here and to talk about multiple sclerosis. I've spent my whole life working on MS. I first began seeing MS patients in the 70s when I was a neurology resident. And I remember seeing someone who had MS and making a diagnosis. And the question was, well, okay, I have MS, doctor, what treatment do I take? And there were no treatments. There really wasn't any treatment. And then the question is, well, can you do an X-ray to see what my MS looks like or whatever? And at those times, there were no X-rays. An X-ray didn't show MS. When the CAT scan came out, that didn't show MS. But I said to the person, I'm sure that we will have treatments. I'm sure we'll figure out some kind of X-ray. And it turned out to be true. We now have MRI imaging where we can look inside the brain and see MS. To be able to image the brain and see inside is crucial for MS and a disease. If you go back into history, tuberculosis was one of the big diseases, and there was a time that we didn't have chest X-rays. And you would treat someone with tuberculosis by putting them into a sanitarium and seeing how tired they were. Are you more tired? Are you less tired? There wasn't a chest X-ray. So there have been major advances. There's other diseases that we haven't been as successful. Alzheimer's disease, no treatment. Lou Gehrig's disease, no treatment. Certain types of brain tumors, no real treatments. But multiple sclerosis has been one of the success stories in neurology. We're not there yet, but we're getting there. And we've really learned a lot about the disease. So what I'm going to do this morning, and we'll talk later, there'll be a chance for everyone to ask questions, is to tell you where we are, how we understand the disease, what aspects of the disease we're now thinking about, and where we're heading. So that's a lot to cover. I'm not going to be able to cover everything, and I want to stay on time, but there'll be a question period. So I want to share with you where I think we are. So Jamie, could you help me a little bit with the slides? And I'll have to see, I may go down and run the slides myself, but I'll try and stay up here because I think it's easier to hear. So here's a slide, a simple slide, a kind of a pie chart, which is a very important slide. And it talks about disease progression in MS. Can people see it? Everybody can see the slide? So on the left, it says relapsing remitting, RRMS, 85%. It says PPMS, that's called primary progressive MS. And then it says after 10 years, you'll see some people are relapsing remitting, some people become secondary progressive, and then there's the primary progressive category. So this pie chart is a very important concept about MS. Because most of the disability that comes with MS comes when people go to the secondary progressive stage. That's where most of the disability comes from. And most of the drugs, virtually all of the drugs that have been approved for MS are approved for relapsing remitting disease. That's the easiest, it's the earliest. And we have now 10 approved drugs, and they were all approved for relapsing remitting disease. There's a number of trials in secondary progressive and primary progressive disease, and I think we're going to get some drugs for this form of the disease. One of the things that is important is to understand the mechanisms, what goes on in the relapsing remitting disease versus the progressive disease, because you need to understand something before you can treat it. When we wanted to treat polio, if we didn't know about the virus, we couldn't have treated polio. And you're going to see, as I explained to you, all the things we know about MS, and then we can talk about how we might treat secondary progressive MS. And then we're going to talk, how do you cure MS? I think for the first time we can think about curing MS. I wrote a book called Curing MS. Some of you may have read it. It was published, there somebody's got it right there. It was published, I think in the year 2000, and then we came out with another. So this is about 10 or 15 years ago. And I'm now working on another book about MS. And the title now is called Multiple Sclerosis, A Cure Within Reach. So rather than curing MS, it's multiple sclerosis, a cure within reach. So I think we're making a lot of progress. So let's go to the next slide. Here's a picture. You know, they say a picture is worth 1,000 words. So here's a picture. Comes from our center. This is a three-dimensional picture of a brain and MS in the... Here's the laser pointer. Oh, we got a laser pointer. Now we need to... Oh, okay. There we go. So this is the brain, or an image of the brain. This is the ventricles, the spinal fluid, and this is where the spinal fluid is. And this yellow is MS. So that's what the MS looks like, and you can see the MS is around the ventricles. Like now, there's been a lot of advances in MRI, and let me show you some of the new things that we're trying to understand in the MRI. One of the things are cortical lesions. You may not be able to see this, but here's the brain, and the brain has deep lesions, and we now know that there's areas that are abnormal in the cortex on the outside of the brain. And this may relate to disability, and this may relate to how new drugs work. So our ability to look at the cortex, the outer parts of the brain, are very important. Another area of the brain we're looking at now is the deep gray matter structures. You don't have to know all this, but here's the brain, and this is the deep gray matter structures. And what we've discovered is that some of the gray matter structures may be very important, and we're now measuring that in our patients. So we have much more advanced imaging. We've been using 1.5 Tesla, that's the strength of the magnet, and now we're moving to 3 Tesla so that it's twice as strong. And now there's a research magnet called a 7 Tesla. If you get in one of those machines, you feel a little warm in it, but it's not dangerous. And now we're doing very sophisticated imaging so we can look at that, at the brain. And this is another picture that shows some atrophy in the brain. The purpose of this is to tell you that we have much more sophisticated imaging. And one of the things we're trying to understand is different types of MS, who might respond to therapy or may not respond to therapy. and the MRI is becoming more and more sophisticated. Now, here's the big question. Here's the big question. I mean, if we want to treat and cure a disease, the big question is, well, what causes it? So maybe I'll ask somebody here what they think, what causes it. Who wants to tell me what they think causes it? Before I ask that question, let's say you're a researcher and you're doing experiments, or you want to understand a disease, and you want to understand MS, right? So one of the things you would do, what you'd like to do is you'd like to take the tissue of someone who has MS and you'd like to look at it under the microscope, right? What does it look like under the microscope? What does MS look like if you look like, and so what does it look like? What do you see when you look under the microscope at MS? Who wants to, you see the brain, right? You see brain cells. What else do you see in the brain? Does it look normal? Is there something abnormal? Who wants to, has anyone looked under a microscope here? What do you see when you look? Yes, what do you see?
Lesions on the brain.
Lesions on the brain. Now lesions, that's good, but it's not gonna, you're not gonna get an A for that answer. Lesions means that there's something abnormal, okay? So the question is, what's made up of those lesions? So I'm gonna ask Dr. Stankiewicz. He better be able to answer this. What do you see when you look under the microscope in the brain that shouldn't be there? Inflammatory cells. So that's correct. So what you see actually are white blood cells that have come out of the bloodstream and have gone into the brain and are causing damage, okay? Now these same white blood cells, another condition that everybody can understand is kidney transplant, right? Kidney transplant. So if you get a kidney transplant, and what does the body want to do even though I'm picking on Dr. Stankiewicz, I can pick on Dr. Edwards. If I took my kidney and put it in Dr. Edwards, even though he respects me, etc., what would his body try to do to my kidney? Reject it, that's correct. And if we were identical twins, he wouldn't reject it, right? Because we're genetically identical. But his body would try and reject it, and he rejects it with the immune system. His immune cells go to my kidney and try to reject it because it thinks of it as being something foreign. That's why we give immunosuppressant medications. And it's those same cells that will be used to reject a kidney that you see in the brain of somebody who has MS, those same type of cells. Now, what if you have an infection, a viral infection of the brain? There's a virus in the brain. The immune system is also to fight off viruses, right? We have the immune system to fight off viruses. And the fact of the matter is, the same immune cells that might reject the kidney are also going to try and fight off an infection in the brain. So the answer to the question is that if you look in the brain of MS patients, you see these immune cells and they're attacking the brain. So now why in the world would they want to go to the brain? So with that question, so there has to be an answer. I mean, if that's what MS looks like and those cells are there, there has to be an answer. There has to be some reason. And so now we can go through the potential reasons. And the first reason that everybody thought of and that they studied is that there's a virus in the brain. There's an infection. And MS would be very easy. And I show the word viruses here. MS would be very easy to understand, like polio virus, smallpox virus, HIV virus, that there's a virus in the brain, an MS virus, and it causes damage, and the immune cells go in there, and that's MS. Very simple. Now that's a very good theory, and for many years, people thought that MS was a virus. In fact, MS patients are not allowed to give blood at the blood bank because maybe there's a virus in their system. We now know that there is no MS virus, and MS patients can now donate blood in the blood bank. They didn't used to in the past. They're allowed to donate blood in the blood bank. And there have been many studies to try and find a virus in MS. They took tissue from an MS patient and put it into a monkey and did genetic testing and everything, and no one has ever been able to find an MS virus, even though there have been many reports. And if you go through the history of MS, you'll see big headlines. MS virus found, now we need to vaccinate, et cetera, et cetera. But that turned out not to be reproduced. Now, the first drug approved for MS it was an interferon called beta-seron. People heard about that. One of the interferons that are used for MS is beta-seron, Avonex, Rebif. These are classic drugs, the first drugs used for MS. And they were tested because they thought MS was a virus. The word interferon means that the compound interferes with the growth of viruses. Now, the interferons worked in MS, but they didn't work because of a virus. They worked because they worked on the immune system. So there is no MS virus, but that doesn't mean that viruses couldn't play a role in MS. And one of the viruses that we think may play a role is EBV virus. EBV virus causes mononucleosis. Now, everybody gets infected with the EBV virus, but MS patients may respond a little different. They may respond a little different. Another thing that we know that if someone has MS, if they have an upper respiratory infection, that can trigger an MS attack. So that viruses can trigger attacks in MS patients, and we think that they're involved in the disease, although there's no MS virus per se. That's what we know about the viruses. Now, if EBV virus really is one of the causes, maybe one day we can vaccinate against it. How could a virus be involved in MS without infecting the brain? Well, there's something called molecular mimicry. I'll tell you about that. It's a very interesting concept. There may be structures on a virus that are similar to structures in the brain. If you look at the virus and you look at what it looks like, there may be some structures on the virus that are exactly like a structure in the brain. So the virus comes into your body, the immune system goes to attack the virus, but then it goes to the brain and sees something that looks just like the virus and attacks the brain. So that's called molecular mimicry. And there's a disease that we all know about that relates to getting strep throats, right? It's not good to get a strep throat. Why is it so bad to get a strep throat? Does anybody know why you don't want to get a strep throat? What other disease can you get after you get a strep throat? Anybody? Doctors, what? Rheumatic fever. Who said that? Okay, you go to you get your MD just like that. And that's true. You can get rheumatic fever because there's something on the streptococcus. That's an organ. There's something on the streptococcus that is also on the heart valve. And so the body fights off the streptococcus and then goes to the heart valve and causes rheumatic fever. So it's very possible that there's something on the surface of the Epstein-Barr virus or another virus that could be one of the reasons why that happens. So there's viruses, but that's not the whole answer. And the next thing we know is that there's genetics. Now everybody says I'm just making sure I stay on time. Everybody knows that, everybody asks the question, well, I have MS, could someone in my family have MS? MS is generally not a genetic disease. It's generally not a genetic disease. It's generally sporadic. But there are families that have more MS in them. And we know that certain genes relate to MS, and all the genes that relate to MS relate to the immune system. They're genes that relate to the immune system. And this is, MHC stands for Major Histocompatibility Complex. And that's a gene that's very important for how T cells or certain cells interact and create immune responses. And they, in the world now, they do these very sophisticated genetic studies. They're called GWAS scans, where they look at thousands and thousands of genes in thousands of patients. And all the genes that come up relate to the immune system. All the genes that come up relate to the immune system. So this helps prove that MS relates to the immune system doing something that it shouldn't do. So we have viruses, we have the genetics, and the next, which is very interesting, is the environment. And we know that the environment is very important, and one of the very important environmental factors is vitamin D. Okay, how many people here know about vitamin D related to MS? How many people are taking vitamin D? Okay, so vitamin D is very important. MS, a very interesting thing related to MS is that it's more common the farther you are away from the equator, which is kind of interesting. And we think that may relate to sunlight, and it might relate to vitamin D. What does vitamin D do? Vitamin D can affect the immune system. Vitamin D can affect the gut, and we'll talk a little bit about the gut. And there's trials that show that if you take vitamin D, or you do better with your MS. It isn't a cure. If you have low levels of vitamin D, we recommend that people take more vitamin D. So vitamin D is very important, and I think it relates to the gut, and I think it relates to the immune system, and we'll talk about that. Now, a new area that's become very interesting to everybody is the gut itself and diet. Now, the gut is, we now know, is one of the major immune organs of the body. When you think about it, if you just stop and think a little bit, we're always putting everything into our body via the gut. People are doing it right now, right? And we actually put tons of things into our body. And the two ways that we communicate with the environment is via the gut and via the lungs, right? We're breathing all the time, and we're eating all the time. And so and in fact, the gut, when you think about it, the gut is actually something that's outside the body, but it's in the body, right? Because you put something in your mouth, goes through your intestine, goes through the tubes, can come out the other end. It's really kind of a tube that runs through the center of your body. And that tube then absorbs things, okay? And that tube isn't sterile. It's a way that we're communicating with the environment. And in the gut, because of its importance in evolution, in the gut is the largest number of immune cells in the body. There's all these immune cells, T cells, B cells, natural killer cells. I can list Th17 cells. I mean, I can tell you all these immune cells are in the gut. And you know what else is in the gut, which people don't realize, are bacteria. Our gut are full of bacteria. And here's a question: how many bacteria do you think we have in our gut? Who wants to guess? Give me a number. Somebody. Billions. How many? 5 billion, more than 5 billion. 100 billion, more than 100. Well, we got to keep going till we get there. How much? 250 billion, more. How much? 3 trillion, more. 700 trillion. We have 700 trillion. In fact, there are more of those in our body than cells that we have. It's fascinating. It's really fascinating. And this is a whole new area of research, because those bacteria are there for a reason. We live in symbiosis with them. They help process things. They help do things. And we know that they can be related to disease. So, for example, there's mice that can get MS, and if you they spontaneously get MS. They've been genetically and if you raise them in a facility that they're not exposed to germs, they don't get the MS, and then you put in certain germs and they get MS. It's very interesting. There's also studies now, and this is called the microbiome. It's called the microbiome, and the scientific community is very interested in studying the microbiome and how it affects disease. I'll tell you an interesting story. They did a study of, so it depends on what you're exposed to when you're a kid, etc., or a baby. They did a study of children or babies or whatever, where, you know, mothers sometimes give the baby the pacifier, right? And some mothers, when they give the baby the pacifier, they clean it in their own mouth. The mother kind of puts it in their mouth and then gives it to the baby. Some mothers don't do that. They just give it to the baby. And so they did a study, and if the mother puts the pacifier in her mouth and then gives it to the baby, that child, when they grow up, have less allergies. And why is that? Because the mother is giving certain bacteria and other type of organisms that's colonizing the baby. So we also think that we don't want to live in too clean of an environment. You know, it's good to be exposed, so if your kid wants to play in the dirt, let him play in the dirt. It's probably good. They also did studies with dogs. If you have a dog in the house, it doesn't protect against allergy as much as if you have a dog that goes outside, because then the kids have that. So we know that the gut microbiome is very, very important. And I think that's one of the new frontiers in terms of understanding MS, and may be a way that we ultimately will get a vaccine, because I think we ultimately are going to give people when they're younger, or maybe the whole population, something that affects the gut, something that affects the immune system, so that you don't get MS. So we were just at the American Academy of Neurology meeting in Philadelphia, and presented some of our work, and we're the first people to do this, but we're beginning to look at the gut of MS patients. So we do that by taking a stool sample. Doesn't sound so good, but people get used to it. And they take home a kit and send in a sample, and then we do genetic analysis of all the bacteria in the gut. And we found that there's certain bacteria that may be elevated or not as elevated. And actually, Dr. Stankiewicz is leading a big study on this, and we may then learn what things in the gut are important for MS. We're actually doing a study, again, that Dr. Stankiewicz is leading, of probiotics, where you give certain types of good bacteria to MS patients to see whether that helps. Now then people say, well, what probiotics should I take? Well, we don't know, but diet becomes important. Vitamin D is important for the gut. We have a study, I'm trying to tell you some new things. We have a study that Vijay Kuchru in our laboratory did that shows that salt, if you have a high salt diet, it's not good, and that animals get worse MS type disease. So I think in the future, we're going to be more interested in the gut, and we're going to actually, I think, have compounds that we give that will not be toxic, and that will act on your gut, and will help the immune system, and will help MS, and may lead to a vaccine. So I think this is a very important thing for the future, and this is a very big area. So there you have the gut. I can't tell you what diet to take, you know, should I eat this, should I eat that? Gluten, we don't know enough yet. Obviously it's good is to have a healthy diet and to take vitamin D. I think that's what the recommendation would be. If you want to take some probiotics, you can take probiotics that you take off the shelves, but we don't know which ones will be good. Now the last thing on this slide related to the environment is smoking, and we know smoking is not good for you, and all the studies show that smoking is bad for MS. It's kind of surprising how strong the data is, but if anybody here has MS and they're smoking, you have to stop smoking. If you're smoking anyway, you shouldn't smoke, but why? What does the smoking do? I'll show you some slides in a second about the different immune cells. And one of the immune cells that is very bad for MS is called the Th17 cell. It's a name of it. And the smoking increases these Th17 cells. So there you've got the environment. So you can see how complex MS, and it's actually exciting that we've made all of this progress. Now, some people think that MS is primarily just a degenerative process in the brain, and I don't think that's true. I think that it's very clear that if we want to know what MS is an autoimmune disease, and I put this here in red. That means the immune system is attacking itself, autoimmune, okay? okay? The immune system is attacking itself. The immune system, for the reasons we spoke about, thinks that the brain and spinal cord are like the kidney that shouldn't be there, and it's going to attack it. And why does it do it? It does it because of viruses that might have structures that are the same, and it might do it because of the repertoire of the cells in a person's body. So let me show you these slides are a little complicated, but I'll simplify it for you. But I want you to get a little feel for our current understanding of MS and the different parts, and this will also relate to the drugs. And I promised Dr. Edwards I will finish on time, and I will. I'll finish at 9:15. So these are in red, and these are the bad cells, okay? These are the cells that we think cause MS, okay? And we used to think there was only one bad cell, this Th1 cell, but now we know there's a Th17 cell, a Th1 cell, a CD8 cell. And these are precursor cells. These are the precursor cells here. And the precursor cells, this could be a virus, it could be other things. And this precursor cell, depending on the chemical, becomes a bad cell. And so IL-12 causes Th1, TGF-beta and IL-6 causes Th17, TGF-beta and these cause Th17. A B cell can also be bad, and we're going to talk about the different drugs that work in MS and how they work. And these cells, they get generated in the blood, and they go into the brain. Here they go into the brain. Here's the brain, and they cause damage. Okay, so it's sort of like the cells going to attack the kidney. No, here are the cells going in to attack the brain. Now, Mother Nature always has balancing, and these are the good cells, and they're called regulatory cells. I have them in blue. There's also different type of regulatory cells. There's a TR1 cell, a CD25 FOXP3 cell, a Th3 cell. We described this in our laboratory. And these regulatory cells can regulate the bad cells. So here you have this picture. I apologize that it's complicated. I did not create it. Somebody else created all these cells. And if you look at the MS drugs, I can show you where they work. So let's start with an easy one, natalizumab or Tysabri. And this blocks cells from getting into the brain. It attaches to a receptor here and blocks these cells from getting into the brain. And that's why people don't have attacks when they take Tysabri. The interferons, Rebif, beta-seron, Avonex, block a little bit of these cells going in, but they increase this molecule here called IL-10, which makes good cells. And that's how the interferons work. Copaxone triggers these cells. Copaxone triggers the blue cells, and that's why that works. Gilenya takes these cells and traps them over here so they can't get into the brain. The Tecfidera also traps these cells and affects these cells. Rituxan, or rituximab, which affects B cells, it knocks out the B cells. Now it knocks out both the bad and the good B cells, but the bad B cells are increased in MS, and so it knocks out these cells, and then the good B cells come back. Did I miss any drugs? Oh, Copaxone I mentioned. Copaxone works down here. Alemtuzumab, or Lemtrada, which has not yet been approved and everything, it kind of knocks out everything. It's this giant sledgehammer, just like Cytoxan, cyclophosphamide that we used, but you have more of these cells, and so it knocks out everything, and then these cells come back. So it sort of shuts everything down. Any other drugs that I didn't mention? Okay, so Aubagio, that's a good one. Aubagio affects these cells, shuts these cells down. And the fact that we understand all these networks allows us to develop different drugs. Then the question will come up, you know, in your own mind, you'll say, well, could you combine them, you know, that type of thing. And the answer is yes, you might be able to combine them. The other thing that we're trying to do is to come up with a blood test that will tell you where do these cells sit in the bloodstream, so you can tell how people are doing. Now, this isn't the whole story. This isn't the whole story of MS, and let me show you more of the story of MS. Now we're inside the brain, okay, we're inside the brain. Here's the cells coming in from the outside, They go into the brain, here's the brain, and they cause damage. Here it says axonal and myelin damage, they're causing damage. And they release things within the brain. They get picked up by other cells, and new cells come into the brain. So that the concept here is that as you're attacking the brain, you can set up kind of a chain reaction. And that's why we like to shut down the disease as soon as we can. We don't want it to kind of get going. Now, the other thing that happens is that once you have damage within the brain, this is called the innate immune system. These were T cells, these are all T cells, but in the brain you have something called microglia and astrocytes. These are cells within the brain. These cells get activated, and then they can affect other cells called monocytes, which are in the bloodstream, and those cells can come in and set up this chronic inflammation in the brain. And this is what we think relates to progressive types of MS, that you start with attacks where cells come into the brain, then you set up an immune reaction within the brain, and that kind of keeps going. And now we're trying to develop drugs that affect these parts of the immune system within the brain, and that will allow us to have treatment for progressive type of MS. Now, you certainly could ask, well, one of the best ways to treat this is don't let it happen, right? Stop these cells from coming in, and that's why we think treating early is very important. And as we learn more about it, we may treat more aggressively very early. So here you have, and I'm gonna then stop. Here you have a picture of the immune system in MS. So early you have this relapsing remitting disease that we spoke about. This is gadolinium enhancement. This is the, I know the people here who've had MRIs, you get a dye injected and they're looking to see whether there's inflammation. And so you have this happening in the relapsing remitting stage. But later you sometimes can get into the secondary progressive phase where it's not as much inflammation outside the nervous system, but it happens within the nervous system. And these are the cells we need to worry about. Here we worried about T cells and B cells, and here we worry about microglia, monocytes, and dendritic cells. So the fact that we have this picture and these different targets is very exciting, because that means we can develop drugs against that. And one of the things that we personally are working on are these microglial cells, because we think they get activated and they're not good in the brain, and we want to shut them down. And also the monocytes. So there's an up-to-date view of where we are in MS in 2014. MS is an autoimmune disease. We've proven it because we have drugs that help MS. There's no question about it. We know the pathways. We want to get better drugs for the pathways. We can measure on MRI, which is very important. We're beginning to learn about the gut and the environment and how we can affect the environment. And the other big thing we're doing is trying to come up with blood tests so we can measure all of these different things, and we may talk about that later. So it's a pleasure to be able to be with you here today and to talk to you. as a doctor, I've really spent my whole life studying MS. Sometimes people say, well, how did you get into this? Did someone in your family have the disease or something? Actually, my childhood friend had MS. He's still with us, and I remember him when he came down with his MS. I was still in medical school, so that affected me a little bit. And then when I was a young doctor, I saw a young man who had MS, and he had 2 boys, and they were the same age as my 2 boys, and I kind of identified with him. This was in the 70s, and that's how I started on the journey. I'm thankful that I've been able to witness all of these advances and that we can continue to move forward. So thank you very much.